Hi, my name is Sandra. I'm going to present to you today on how to perform Mohs surgery in an office workplace. Mohs surgery is used to treat two common skin cancers known as a basal cell carcinoma and a squamous cell carcinoma. Mohs surgery is 97 to 99% effective in treating a basal cell carcinoma. It is 95% to 97% effective in treating a squamous cell carcinoma. Mohs surgery is performed in an outpatient setting and utilized in most dermatology clinics. Mohs surgery is done under local anesthetics done in your facility. Typically, if you go to the dentist, they use the same local anesthetic as using in the dentistry field. First off, you would get your patient, have them lie on the bed, and you would position them to be ready for when the doctor has to come in and mark the patient. The reasoning he would come in to mark the patient is to mark where the skin cancer is, because Mohs surgery is considered a tissue-sparing surgery, meaning you do not want to take more than what is necessary of what is not the skin cancer. So first off, the doctor would come over and grab a purple marker. He would then come over and situate himself and come over and find the skin cancer and come over and draw a circle around the skin cancer. He would then notch the circle, in which he would notch typically 12, 3, and 9 like a clock. This is in order to mark the skin cancer in case it were to get flipped over in process, get dropped on the floor. That way there are notches in the tissue in case that were to happen, and this is what this would look like. So they would then have the tech come over and get the petri dish and do the same exact drawing as done on the petri dish and have the X marked to the right shoulder of the patient. That way the notches match as same as the patient on the bed. They would then get the map and draw the same exact circle with the same notches on the paper. That way when the lab goes in, they will paint around the tissue around each notch. That way when they process the tissue in the lab, they will use a cryostat to cut the tissue to fit it on a microscope. And then they are hand dipped in a Mohs stainer through some Hematox, which has purple ink, pink ink, that demarcates whether the patient still has skin cancer or not. That way he can look under the microscope to see if he got all the skin cancer. So the doctor would then come back in and glove up and utilize his Mohs utensils, which the first one he would use would be the curette. The curette is used in Mohs surgery, which has a little hook-looking thing on it used to demarcate the skin tissue. This way it gets around the borders and gets rid of the extra skin that is on top of it. Then he would get his scalpel and pick up, and then he would cut around a 45-degree angle around the skin tissue, and then he would place it exactly onto the petri dish right here, lined up with the same notches as on the tissue. Then you would transfer it to the lab. They would do their job processing the tissue. You would have the patient then wait out in the waiting room 45 minutes to an hour while the tissue processed. At that point, the doctor would go into the lab and look under the microscope, see if he got all the skin cancer. If the doctor did not get all the skin cancer, you would then bring the patient back into the bed, have them situated, and then Dr. Slavik on this piece of paper would have marked in red where exactly the skin cancer, according to the notches, is still present. Then he would come in and only take the area that is still positive onto the patient, then transfer it back onto the petri dish, back in the lab, and you keep repeating this process until the patient is 100% sure that the skin cancer is no longer there. The patient will leave the facility knowing that he is skin cancer free after performing Mohs surgery. Mohs surgery is the gold standard of surgery in treating a basal cell and a squamous cell carcinoma. Overall, Mohs surgery is used worldwide and is a very popular surgery in order to treating a skin cancer. Thank you for taking the time listening to my presentation. I hope you learned about Mohs surgery and its effectiveness on skin cancers. Thank you.